Hello and welcome to SEDS. My name is Dr. Fleming and I am the director of the center. It is my pleasure to welcome you to my office, but also I consider it a huge honor and privilege to be able to speak to Meharry student leaders. Now, I would be remiss if I did not ground us in a particular context, and you'll have to forgive me because I'm very much, up with the people, power to the people, and making sure that what we are doing is connected to everything that's going on in the world. And with that in mind, and especially knowing the times that we live in, we have to acknowledge that here at Meharry, we are standing on occupied lands. The lands of the Cherokee, the Chickasaw, the Shawnee, the Choctaw, the Yakchi. And we have to acknowledge that their removal to create a space for what would become Tennessee and Nashville, and yet their survival to maintain their cultures and communities is essential to what we are called to do as Meharians. We also have to acknowledge that it's 2020 and today is October the 14th, and Breonna Taylor, Ahmaud Arbery, and George Floyd have yet to receive justice. And I state without apologies, without explanation, that Black Lives Matter. And it's important that we recognize that Black Lives Matter, and at the same time, Black bodies and Black votes may not matter. So consider this my call to you to figure out where you'd like to take action on any of these issues, whether it's land acknowledgements and what's going on in Native American communities, social justice issues that are happening in Black communities, or just the very thought that the care and services that you will provide to communities in need will be that act of justice. Now, I realize you didn't come for any of that consciousness awareness, but whenever I get the opportunity to speak, that's the place that I speak from. Now, I had a number of ideas percolating in my head as to what I would tell you. And at the encouragement of your colleagues, they told me, in not so many words, but this is what I heard. Eleanor, tell your story. Now, you don't have to tell me twice because I like telling my story, and it's important to note that I am a Meharian. I'm a Meharian who didn't necessarily or just graduate from Meharry, but I came to Meharry to be a Meharian. Let me tell you the story. And forgive me, I like Golden Girls, so I'm just gonna dip into a Sophia moment. Picture it. Nashville, Tennessee, 2004 or 5. I'm a graduate student at Vanderbilt working on my PhD in political science. And I have an opportunity to go to a reception where Dr. Maupin, the president of Meharry at the time, was speaking. And Dr. Maupin, so real talk, I only went to this reception because I wanted to go to the restaurant for food because I was a graduate student. So I came to eat. I came to eat. And I did. And it was really good. I think the restaurant is closed, but the Italian food was really good, as I remember. But Dr. Maupin made this appeal to the alumni and community members who were at this event. And he started telling the story of Meharry. We all know it, but it was news to me, about the salt wagon, and he's telling the story about the future of Meharry. And he puts out this call about what he called the trilogy of giving. Now, mind you, I am a graduate student. I didn't have any money, but I took to this hook, line, and sinker. And he said that to the alumni, to the community together, that we have to support Meharry, and we have to support it in particular ways. You do your regular giving, you give to major gifts, and you remember Meharry in your trust. And there was something about hearing him speak about that, and maybe it was how he spoke. But I said that I want to be a Meharian. Like, I want to be a part of a community that's about sustaining itself, that is mission driven in a way that I never saw at at Vanderbilt, which is where I did my undergraduate and graduate trainings. And I remember at the time I was in graduate school and was working on my dissertation at this point, and I started a yoga practice. And so I was using a mantra to get me through. And the words I was focusing on were worship and service. And I figured that I need to find something to do with my life that would allow me to do these two things. Now, mind you, I was in graduate school to become a professor to teach young people political theory and American politics. So worship, service were my mantras. Worship, service. Having heard from Dr. Maupin, been inspired, I go to the dental school because I had decided I wanted to be a dentist after hearing Dr. Stacher write about the oral health of this nation and the gross disparities that, being from Franklin, Tennessee, I couldn't even fathom. And I get to the dental school, and right in front of me was the seal, and I can see it like it's right in front of me now. And I saw the school's motto, and I said, that's it. This is where I'm supposed to be. So I ended up writing my dissertation by day, going over to Nashville State Community College to do my prerequisites. Yes, I am a community college alum. Big up to community college students and graduates. And I came here thinking that I was going to be the dentist to eliminate disparities. Like, I was really that naive. But I think it's the naivete that helped me, because I came here a blank slate. And the only thing I knew I wanted to do is worship God and serve my community. And then Diamante Driver died. And there was something about seeing his picture in the Washington Post. It was something about reading Mary Otto's story about his death. And let me just backtrack, because my guess is not everyone knows the name Diamante Driver. So Diamante Driver was a kid in Prince George's County, which, by the way, has an accumulation of black wealth that is second to none in this country. Like, it's kind of accumulated, you go there to live the black middle class dream. And Diamante's mom, Miss Driver, was looking for a dentist for Diamante's brother, who was complaining about his teeth. Miss Driver had some kids, a low-paying job, housing insecurity, and you get the picture. She was a person who needed a Maharian. But there were no Maharians there to meet the needs for Diamante and his family. And so Diamante ended up getting sick from a toothache. And long story short, the toothache turned into a brain abscess that killed him. And Diamante Driver died. And it became this rallying cry to the oral health community, like, how could this happen? And who dropped the ball? And who can we point the finger at? And it's like, who do you point the finger at? Like, seriously? Like, you have a mother who is trying to provide for her children and her family. We have what we now call and talk about social determinants of health at work. We have racism, we have poverty, we have all of this compounding of things, in addition to thinking about, why didn't this kid just have a sealant? Did this kid have access to fluoridated water? Did he have access to any of the things that most of us probably had? And the answer is no. And so Maryland did all of this great work. The National Dental Association came to the table, and now there's kind of outreach programs to provide access to children's dental care. But Diamante Driver still died. And when Diamante Driver died, I was like, you know what, I've got to use these hands, these buzzard hands, as Dr. Tyus would say, to do something else. And that something else for me became public health. Now, I didn't know what it was at the time, but I knew that it had something to do with impacts beyond me and a patient. And so my journey starting my junior year in dental school was to figure out how I could do something so that future Diamante drivers wouldn't happen. And at most, all children, all people would have access to care, right? Still idealistic, but that's just who I am at heart. And so I found my way somehow surviving the dental clinics, which is only an act of God, but I graduated. And went on to CDC, where I became an Epidemic Intelligence Service officer. Now this is and I'm not saying this to like toot my own horn and to blow myself up, but you can actually like Google this. It is the premier field epidemiology training program in the world. Like, people literally come from all over the world to apply to this 2-year postdoctoral training to learn to be an epidemiologist. Now, my dumb luck, because mind you, I was working on my dissertation, heard Dr. Maupin. Previously, I had read the Surgeon General's report on oral health. And so I just kind of luck into things. And sure enough, I lucked into being an Epidemic Intelligence Service officer, a disease detective, where I was out in the south of the US, where I was in Kenya, where I was doing work to prevent and control diseases, largely around mother-to-child transmission of syphilis, so absolutely nothing that had to do with dentistry, but if I could master Mahari, I could certainly learn about sexually transmitted infections, which I did. And so that started my career in public health. And so you are looking at a proud dental epidemiologist, not an entomologist. I don't know nothing about insects. I don't do skin, but I know the science of population health. And I know the science of population health because Mahari trained me to understand and to accept intellectual academic challenges that were a push, right? Like, I made this weird transition from there is a DO composite that needs to go on tooth number 13 to let me figure out how I can inform public health, dental public health practices around oral health. So I spent 9 years and a few months up until September at CDC. Again, working as a public health scientist and doing this work and building a body of expertise that put me in places and spaces where, to something I heard student Dr. Sim say, where Mahari dentists hadn't been and no one had opened the door, right? So I came in literally opening up spaces. Now you can imagine, well, maybe you can't imagine, but I'm sure you're getting enough of kind of who I am to know that I rarely go places like quietly. And given what I'm telling you, you're probably guessing that I probably ask the question that some people don't appreciate asking. But I do that because that's what we do as Maharians. We do the difficult thing, we do the hard thing, and we always remember where we come from. Again, standing on land that was previously Cherokee, Chickasaw, Shawnee. That we do this coming from a place where, through the generosity of a salt wagon, we exist. We do this knowing that there were Dr. Turpins and that there were Dr. C.V. Roman, Dr. Harold West, that there were all of these giants that built and sustained the place that we get the privilege of studying at and becoming alumni of. Now you're probably wondering, now Eleanor, like, you were doing this thing and it sounds like you must have been like pretty good at it. I mean, they kept you around for 9 years. Like, certainly you excelled at doing some things. Like, why would you be here at SEDS? Like, why would you pivot to do this new thing, which I never heard you say that you had any training in higher education administration. You right, but I'm gonna try to do it anyway. So I came back to Mahari because a couple of reasons. Now, the honest to God reason is that I came because institutional racism, microaggressions, and the idea of having to prove myself as a professional, knowing that I'm a Maharian, is annoying and it's frustrating. And no one wants to be in a system where you're not welcomed as a professional. So, note to you, if you're ever in a space where anybody questions your credentials, where they suggest that you can't do because of this, or if they make any suggestion that you are less than or not as smart as, get out. It's not worth staying and fighting the fight. Take it from a woman who knows. So I was in a work environment that was not conducive to my growth as a person. Now I always knew that I was going to come back to Meharry. I just never knew in what capacity. And so when this position opened up, I had to come back. Why did you have to come back, Eleanor? Because it's in this very office, actually at that table over there, that my freshman year of dental school, I wept. And I wept, and I wept, and I wept, and I cried, and I cried, and I cried, because dental school was hard for me. My grandmother died during my first semester, and it was hard for me to put myself back together. But I was able to put myself back together here at SEDS. And actually, the director at the time who helped to put me back together, I was so in her debt that she put the hood on me when I graduated. And so coming back to SEDS isn't just coming back to Meharry or coming back to any position. It's coming back because I know what this place can do for students who need support. And I needed support. It literally took everything to get out of bed. I would be in dental anatomy class crying because I was so broken in grief. But I was able to be patched up in here and patched up enough to do the work that I had to do up the hill, which again, I repeat to you, is hard. But if I can do it, you can do it. If these hands can get through making some dentures, I know you can. And so I came back with this idea of wanting to serve my institution. Now, serving your institution, and to bring it back to the trilogy of giving, it's important that you understand that you serve not just by being a student leader, which is what you all are called to do, and I applaud you for taking this on and for wanting to say that you want your Meharry to be better than my Meharry, that you want to leave Meharry better than you found it. But there is more to it. At some point, you're gonna either walk across the stage and get that empty folder that does not have your degree in it, but you're gonna get your degree at some point. And when you get it, you get to be an alumnus. You're part of the club. Now, part of the club means that you also have to be a dues paying member. And I say this because I actually, just this morning, submitted my paperwork to be a member of the West Society. So the West Society means that you, when you're called home to glory, that you are including Meharry in your plans of your estate. Now, I should tell you, I don't have millions of dollars. There's no trust fund waiting for me. I just got one woman who was working for the government who came to Meharry. So I'm not leaving gazillions of dollars. I don't have Bloomberg money, but Meharry needs all money. So whether you decide that you're going to give the school $10 a month, if you decide that come, the first time that you are getting a paycheck and you're stable, that you're just gonna send them $100 a year. It doesn't matter how big or how small, but we have to support the place that supported us. And my motto has been that as long as I've got a job, Meharry is going to be getting a check. Now the irony now is that Meharry is giving me money and then getting it right back, so I've got some type of screwy logic. But I just encourage you now to think about how you want to support what moved me as a graduate student, this idea of supporting an institution, of being a Maharian. So again, you're here in my office, and unfortunately we're not meeting in person, but know that you are always welcomed here. You're always welcome to sit at the table, and if you need to cry, I've got tissues. If you need coffee, we can have coffee and chat. But in this virtual environment, please know that I'm always available, and my colleagues here at SEDS are available to support you in any way. So thank you for letting me tell my story. I hope that you found something useful in the story. If not, let Elizabeth know and Sims, because they told me to do this. So you just circle back to them and be like, they said tell your story, but you're like, but that was a bum story. Like, no one really wanted to go on this emotional roller coaster. They said it because I had something else planned. But in all honesty, thank you for letting me be a part of this moment, because I think that it's very important that we just remember what we're here to do. You're here to learn. I'm here to support you. And we're all here for the greater good of Meharry. And we know that Meharry is not perfect. We know that there are things that just don't make any sense. But just like any family, any relationship, we love in spite of. And we keep our hearts open to the abundance of accepting who and what we are, and to committing ourselves to be better and to do better. So good luck in the year ahead. I'm expecting great things from all of you. And again, thank you.
My fellow Maharians, today you expand your commitment to Meharry Medical College, to your fellow Maharians, your faculty, and to the staff and administration by accepting the office of the Pre-Alumni Association, the governing student organization of the college to which you have been elected. We all appreciate and express our gratitude to each of you for assuming this additional responsibility as a student leader. I, therefore, am honored to serve as the person who inducts you into the office to which you have been elected. So I ask you to repeat after me. I, your name and your position, having been duly elected as the physician again, do hereby, pledge to give to this office my full commitment to carry out my duties and responsibilities in a manner that brings pride and honor to the Pre-Alumni Association, Meharry Medical College, and all of its constituents and former alumni. So help me God. I thank you for accepting this pledge and potentially serving as best you can as a student to hold the office to which you have been selected. Before all of the students, faculty, and administrators who have witnessed this ceremony, I pronounce each of you as student leaders of our Pre-Alumni Association for the academic year 2020-21. Thank you.